Hello, everybody.
Hello.
Sorry, it took us 7 minutes extra to get in here. Whoever's started watching us, hello there. Um, so I am Mini Gupta, the lady who's very crazy about tinnitus all the time. I'm a clinical audiologist and I'm based in Melbourne. I've been practicing in Australia for close to 20 years now. Most of the work that I do is in relation to tinnitus and sound sensitivity, and I do that for all the ages. And this is where my clinical focus sits. I've done some advanced studies in tinnitus and hyperacusis, including double certification in tinnitus retraining therapy. And these days, a lot of my work happens through telehealth for people who can't come to us because of the distance issues. And that's why it's really nice to see people joining us from different parts of the world today. Um, I know we have students and researchers joining us from everywhere. Hello to everybody. This session is a part of Tinnitus Awareness Week. Happy Tinnitus Awareness Week to everybody. So many people who live with tinnitus find it very difficult to find help, and they end up just putting up with it and living with it. So we wanted to have a real conversation, uh, and I really hope what we share today feels helpful and grounding in some way, wherever you are joining us from. The aim of this session is to bring the clinicians and people living with tinnitus together in one shared space and to take that conversation out to the world. This is what we need, right? We need to hear from real clinicians and real people who are experiencing these symptoms. Too often, these conversations happen very secludedly in the clinic rooms, in support groups, or in professional places. Here, we want them together. We want people with tinnitus to hear from clinicians who actually work in this space, and we want the clinicians to listen to lived experience in a real human way. My hope is that, and everyone's hope here who's present today, is to help change how tinnitus is understood, how tinnitus is talked about, and how tinnitus is approached. And we want to send a clear message that real and genuine clinical help exists and people do not have to live with tinnitus. Tinnitus is one of those experiences where people are often left very confused, overwhelmed, and very quickly they are told, you just have to learn to live with this. And that message never really sat right with me. So today, it's about gently changing that conversation through real journeys and real clinical work, not just by mere promises and quick fixes. Now, just a quick note before we get into it. This conversation is live and recorded, so please share only what feels comfortable, and there's absolutely no pressure to say anything that you may not want to. This isn't a space for individual medical advice. It's about experience, process, and perspective. And if emotions come up at any point, that's completely fine. Now, moving on to our guests. I'm really glad to be joined by Rachel Gibson from All Ears in Hearing and Dr. Amit Gupta tonight here with me. Rachel is an audiologist at All Ears in Hearing in Brisbane, and she's been working in a private practice for about 25 years now, and she's a business owner for almost 20 years. What's really important to say about Rachel tonight is that she also has lived experience of tinnitus herself. So she brings both clinical expertise and genuine personal insight into this space about her own experience. As an audiologist, she works very closely with the patients to reduce the impact of the tinnitus on their everyday life by doing careful assessment, by the right counseling, practical strategies, and using tools like sound therapy, hearing aids, wherever appropriate. Rachel is also a certified tinnitus retraining therapy provider trainer, and she has been trained by Dr. Pavel Jastrobov and Dr. Margaret Jastrobov, and we did that last year in Melbourne. I
Mhm.
also am joined by Dr. Amit Gupta here. He's a doctor of audiology and has been working in adult auditory rehabilitation in Australia for over 22 years now. Over the last few years, he has developed a very strong interest in tinnitus care, particularly around how he communicates with patients when they first come in distressed looking for answers. He's been doing personal studies in tinnitus in his own free time, like we all have to do in our free time. He applies this learning directly into his daily clinical work, and he has noticed a big shift in how his patients respond and how their outcomes change when tinnitus counseling is done thoughtfully and mindfully. Welcome, Dr. Gupta. We are also joined by a small group of people who live with tinnitus and who have very generously agreed to be a part of this conversation today. I just want to say upfront, they are not here as case studies or as examples, and there is no expectation to share anything that doesn't feel right. They are here simply as people, sharing what their journey actually looked like, the confusion, the doubts, the process of finding the right support, and what shifted along the way. We'll let their stories come into the conversation very naturally rather than doing any formal introductions. So here, even though I don't like passing the mic to other people, but I better do. So I would like to take this opportunity to pass the mic to Stuart. Would you like to uh, talk to the audience and tell us about your tinnitus? Anything and everything that you may want to tell. There's nothing right and wrong here.
Um, sure. I suppose that I first found out that I had tinnitus. I didn't know it at the time, but I sometimes do a meditation practice over at Red Hill. And anyway, we were having a meditation. It goes for an hour. And it was
Stuart,
great.
sorry.
Yeah.
Stuart, sorry, can you hear me?
Yeah.
Your voice, sorry to interrupt, I apologize. Your voice is just a bit unclear. Can you
Audio.
bring your phone close to
Going a
your
bit
mouth?
closer. How does that
One,
sound?
two, three. One, two,
Is that
three.
better?
Yeah, that's
Sorry
better.
about that.
Yeah.
I'll
Okay.
try again.
Um,
Okay.
so meditation. I was sitting there for an hour meditating, and all I could hear were these bugs in the roof. And
Oh,
after
okay.
after the session finished, I said, "Oh, that was great." So I said this to someone, but they need to do something about the cicadas in the roof space. And this girl that I was speaking to says, "Oh, I didn't hear that." And so I walked away thinking, "Oh, she must be deaf if she couldn't hear that." And the next day I woke up and I went, "Those cicadas are still there." And that was then the realization that there was something with me.
Mm.
It wasn't cicadas in the roof at all. So I went to my GP, and she suggested I see an audiologist. Rachel was the designated audiologist, and
Rachel Gibson.
yes, that's right. And we had a bit of a discussion, and initially I declined to take the hearing aids, um, but then in about, I don't know, Rachel would be able to answer this, but I think it must have been maybe 7 months ago, 8 months ago. I got these Udit hearing aids with a tinnitus aspect to it, and it was great. It was really good, um, and I've noticed that using these for just a relatively short time, that I've become less. It's become less problematic for me. It's always there, um, but the sound of the hearing aids can actually sort of like take the emphasis off it. And so I suppose that in some ways it's about concentrating on the sound. Mine is a cicada sound. Um, and I've had periods where, like, I thought I was going to go nuts. It was awful. It was really awful, especially at night. Um,
Right.
Ra- Rachel suggested that I either get a pillow which had audio in them, um, but I just decided, being a cheapskate and a Scotsman with deep pockets, I decided that a phone underneath my pillow uh, would be a good start. And I just played SBS Chill, which has continuous music all the time. So easy to listen to. I think they can't quite remember what they call it, but it's it just sends you off to sleep. And you can. I found that I could concentrate on that without concentrating on the tinnitus, and sort of I could still hear the tinnitus, but I was able to sort of direct my is it hearing or concentration to the music, and that proved really good for me. Um, I I go through waves of, not so much waves because waves indicate that it's happening on a sort of like a pattern. There doesn't seem to be a great pattern. Um, Sometimes it's loud, sometimes it's not. Uh, when I have my hearing aids, um, the pattern, the emphasis on the loud tinnitus goes away, and so it becomes much easier to actually listen
Yeah.
uh, without the problem of having tinnitus at that exorbitant level. Um, yeah, I'm glad that I've got to say that I'm really glad that I went and saw an audiologist, Rachel, because to be quite honest, I didn't know what I was going to do. It was getting to a point where I was, as I said, it was pretty awful. Um, and yeah, I'm glad that I've gone and seen Rachel about this. No, I'd
A very,
recommend it.
very powerful story there, Stewart. So this is what I'm understanding. I would like to repeat so that we can remember everything that you have talked about. And for those who may have missed little bits of your story and just joined us, so your main tinnitus is like cicadas, and you were referred to Rachel Gibson at all ears hearing by your GP. And initially, there was some reluctance to go ahead with the advice for hearing aids, which is very
Yeah,
natural. But eventually, by the right counseling, explanation, understanding, you took the treatment. I mean, the hearing aids are the treatment for it, and it did help you reducing the loudness and perception of the tinnitus. Is that
yeah,
right?
yeah.
Yeah.
That's right.
So it's
Yeah,
so can we say you got relief from your tinnitus?
yeah, absolutely,
Would that be
absolutely.
the right word? Yeah.
Oh, yeah, yeah. From a,
Yeah.
I guess it was at a 7 out of 10. Um, it's gone down to like a 3, 2.
That's fantastic.
Sometimes I don't even hear it. No, I know it's
I would
there,
like to
and of
say that
course,
loud, from 7 out of 10 to 3 out of 10, and sometimes
hmm,
not hearing it.
well, yeah. Now that we've been talking about it, I'm sure that I'll hear it for the rest of the week. But that's the way it goes.
Go back to Rachel and she'll find a way to reduce it again.
Yeah, you've
um,
got an appointment tomorrow, Rachel.
we have just been joined by Keith here. I thought I'll quickly introduce him. And Keith, hello, welcome here. Finally, Keith, can you
I'm
hear me?
in. Thank you.
Hello, hello. Back to Stewart.
I can hear
So,
you.
how long has it been since you've been using your devices, Stewart, that Rachel
Um,
prescribed for you?
I think it was since July. Oh no,
Since July.
actually, I shouldn't. No, that's the ones I've purchased. Uh, but Rachel had gave me access to trial types, so they were sort of there to trial the hearing aid itself, but every one of them had tinnitus um, soundings in it. And so I suppose when you include them, there was probably 3 pairs, maybe 4 pairs that lasted for, I don't know, a couple of months each, I guess. So it was probably, yeah, it's probably been a year or so since I've been using the hearing aids with the tinnitus rectification in it. Yeah.
Well, look, that is where having an audiologist who has done some extra training can be a little bit more helpful. If every audiologist could, everybody would like to do this magic for everybody. But unfortunately, because of the lack of training at the university level and the lack of funds and resources for audiologists, we hardly ever get any extra training. Because of which, unless we take uh, personal interest in upskilling ourselves, the tinnitus world stays the way it is. And there are so many of us who are constantly now trying to upskill ourselves, trying to learn, trying to implement new things in our clinic, which is what looks like Rachel is doing. Maybe we should hear from Rachel what she would like to say about Stewart's journey with her.
Yeah, so with all my clients, I try to make the tinnitus program personalised for them. So we always sort of look at where the situations that they are having a lot of difficulty managing the tinnitus, and then work to try to find solutions to help them a bit. With Stuart, we did try a few different brands because there's some of them like have different types of tinnitus tones. Like you've got the Widex ones, for example, that have those fractal tones, or you've got others that have white noise, pink noise. So I always like to give my clients a bit of a chance to trial different ones to see what gives them the most relief from their tinnitus. Yeah.
Yes, and looks like this is a subset of population where there is a hearing loss. The auditory system is experiencing lack of sound, lack of stimulation, and auditory stimulation. And because of that, our brain, which always likes to keep things balanced at the brain level, is trying to fix the ear by producing the sound. And the easiest way to fix that is give the hearing aid, give the ear what it needs, balance the ear, balance the auditory system, and that relaxes the higher centers of the brain. So the brain has to work much lesser, first of all, to be able to hear what other people are saying, which reduces the overall auditory fatigue that people experience with hearing loss. And secondly, it doesn't have to generate that extra sound that the brain thinks is useful for people. So hearing aids can be very helpful for people whose tinnitus is purely because of hearing loss. Not for everyone, but yes, someone whose situation or clinical history looks like Stewart's, hearing aids are a good option. So if someone's struggling with genuine hearing loss and there's no other associated condition like sound sensitivity or dizziness and stuff, if your audiologist has advised you to try hearing aids, please give them a go. Please, because you don't know. I know there are a lot of places and a lot of online information that says tinnitus can't be treated, hearing aids can't be treated. There's no one advice for everyone. That's the most important thing for everyone to hear. If you have a hearing loss, hearing aids are very important to be tried. But how do you know whether hearing aids are for you or not? If by wearing your hearing aid, your tinnitus feels better and you get relief from your tinnitus, just like what Stewart felt, then that means the hearing aid is going to work for you and your tinnitus needs that. But if by using a hearing aid, and if by doing all the different adjustments that your audiologist has tried with you, if your tinnitus is not becoming a little bit better, or if you're not feeling right with the sound of it, then yes, because of the experience or the extra stress, the tinnitus can get worse. But that's the condition when a specialist tinnitus audiologist comes into picture to see why, with the hearing loss, a hearing aid is not able to help. Ideally, it should, but why not? What are we missing? So that's when a very in depth evaluation is done of the auditory system, and there are more techniques like tinnitus retraining therapy, cognitive behavioral therapy, nighttime sleep therapy that's used for people. So it's very individualistic. It's based on each patient, how they are reacting, where their tinnitus is coming from. I know it's a long debate, but some people's tinnitus may be coming from the ear, some people's tinnitus from the brain level, some people's tinnitus from their autonomic nervous system, the fight and flight system, and they may have normal hearing. So, not one size fits all. And that's why you need someone who can exactly pinpoint what type of tinnitus you're experiencing and where it's coming from and give you the right plan. So, tinnitus can be managed very well. At least you can get the relief. We have had people, I'm sure Dr. Gupta, Rachel, and I, we have all seen people having 100% relief from their tinnitus. But it's not a quick fix. And
Mm.
when we expect to come and have a quick fix, that's when the problem happens. So, realistic expectations, compliance on the side of the person who's experiencing tinnitus, compliance on the side of the audiologist who can work as a therapist with you, and the outcomes are amazing. Well, let's move on to our next guest tonight. That's Keith. Hi, Keith.
Hi.
And we've got
Can you hear
Dr.
can
Amit
you hear me
Gupta here.
okay?
Yes, we can hear
Can
you
you hear?
perfectly well. So,
That's
Keith
great.
and Dr. Amit Gupta know each other as patient and
Hello.
clinician.
Hello.
So, who would want to go first and talk? Amit, Dr. Amit, do you want to talk about how you met Keith in one of the consultations, or would Keith, you want to talk about it first?
I think let Keith go about it and then I'll talk
Okay.
about it.
Okay. So you just want me to give in a bit of experience when I first sought the my welfare with tinnitus. Is that right? Like when I first. Uh, well, I'll just give you a quick brief. I'm an ex-service person, and I think everybody can
That's
experience
important
it,
to
whatever
hear.
type of
Yes.
what sort of experience they had in the past. And certainly, I've been subject to firing weapons, working on flight lines where airplanes are taxiing and coming in, so movement areas is certainly part of the job that I've worked in. When I say movement areas, aircraft, jets, loud aeroplanes, that sort of thing. So I've had tinnitus since I officially resigned from the military in 2001, and I went down the path of trying to report this, that I'm having this issue with a loud ring in in the back of my head. But saying that, it sort of was flared up mainly, and I guess when I first experienced something like that, I thought it was temporary with firing weapons without proper hearing protection in those early days in my career. So I should have accepted it. This will go away in time, but it sort of kept up for a long, long period of time that I sort of went down the path of accepting it. In fact, when I approached the DVA people, they discarded me straight away, saying, "Look, your hearing's fine." And I had good hearing capability then, but still that was there in the back of my mind. So it took a little while before then to accept that I had this issue. For me, I sort of accepted this is just part of my living and so forth. But when I first was brought to the clinic, I actually took my wife there, and she was going through this program initially with the tinnitus that she was experiencing, and I was listening tentatively to see, oh, there is a plan, there is some sort of way forward to assist me cope with what I have. So it was during that early stage that I thought, and this was probably close to just over 12 months ago, I would say. Um, and so listening to what was happening to my wife. She had a trial period, and she was going through quite well. And that was when I sort of approached the clinic and said, maybe there's hope for me as well. So my journey began, just over 12 months ago. And saying that, I've learnt a lot during that period, and it's about coping. I have good days and bad days, and I accept that. It's it's sort of it's more about acceptance of what you have and how you deal with it. And certainly the path that I've been shown with wearing the hearing aid and so forth is I was having some issues in a crowded area. I was having issues late at night, but some of the programs and the chats we had was how to minimize that disruption early in the morning or going to bed at night time or that sort of thing. That really helped me to be more accepting. And it's not, as you said before, it's not a quick fix. It's one of those things that I think when you accept that, you're more in tune to say, well, that's part of life. What can I do to alleviate that? And certainly I love music. So I'd have a light music playing in the background to assist my day, so much so that I forget about my tinnitus. That's how good it is. I can, it works fine for me when I'm listening to music and my mind's occupied with something else or I'm busy. Now, when I'm, like late in the evening or early in the morning when I do get up and it's absolutely quiet, I know that that's a period where I need a sound therapy that I have access to with the hearing aids that I have, and also, having it on my phone that I could turn up and down. That actually gave me more, put me more in control of how I can assist that denigration with my hearing. So yes, I'm certainly glad I went down this path. And as I said earlier, it's not a quick fix. It's one of those things. It's helped me to cope with my daily routine in my daily life that I'm very grateful for. So thank you very much for that. Yeah.
Very grateful to you for sharing that story in such big detail.
Thank you, Minnie.
Um, I would like to point out a very important detail here, which we know as clinicians, we have talked about it, that the first encounter that Keith had with the audiologist who could explain about tinnitus in a way that sounded positive and hopeful. Do you think that made a difference for you to take a step and to come back for it?
Oh, certainly. Anything to assist me with more knowledge. Like I didn't realize there's so much science involved, and not only that, I think for me personally to be able to accept the condition I have and not being too hard on myself and saying, well, this is part of life,
Yes,
the good and bad, and it's
yes.
more about just amending my ways to not be stressed out and not being well, I'm going through this little phase at the moment. I might have to turn that music up, something like that, and so that's helped me a great deal. I'm really glad that DVA, when I say that, Department of Veterinary Affairs, have now advertised on the Facebook for people that have this issue to come forward. So much so that I spoke to a colleague of mine tonight to say, look, mate, have you done anything about it? Because there is a program out there to help people like you and me, get more out of life than you think you have to cope with. So I'm going to send in the link to this video, this YouTube channel, and say, look, I want you to look at this. He's in Queensland. He's driving at the moment. So I said, look, you really need to listen. There is there is something out there for us clinically that can assist in everyday living that will help your pathway forward anyway, and not be too frustrated.
For spreading the message, that's what we need, all of us.
Yeah, definitely, definitely. Yeah.
Let's listen to Dr. Amit Gupta. What does he have to say about his consultation with Keith, and in general, what is his opinion about what he has just heard from Keith and Stewart and Rachel and I? Yes, Dr. Gupta, to you.
Look, first of all, thank you for the opportunity. Keith, I've been listening to what you're saying, so I'll come back to your experience. But I want to let everyone know, especially like initially when I started, like most of my fellow audiologists, when I would see a patient with tinnitus, my first response would be to agree with their GP or ENT that yes, we can't do much about it, you have to learn to live with it. Uh, and sometimes there were people who had hearing loss where we say, okay, hearing aids can help. Sometimes they would help, other times they won't. So we just say that there's not much we can do about it. But over a period of time, with personal learning and time, I started to look at it differently. So my approach changed completely, to the sense that when I realized I started to think from patient's perspective. So when they enter your room and they have tinnitus, they have already been told a lot of times nothing can be done about it. You have to learn with it. They are very depressed. They are very stressed. Sometimes they are stressed to the point that they can't sleep. So when they come to you, they say they feel that they are wasting their time because nothing can be done about it. But then after reflecting, listening, and reassuring them that no, that's not true, you can be helped and there is help as long as we are able to find the right cause and the trigger what is causing it. Definitely, the tinnitus, if we can't cure it, we can definitely treat it. That itself, that reassurance is the half of the battle won, because when they step out of your room, they believe that yes, I can be helped. So that's the change I have, or experience I have learned over a period of time, which has really helped in dealing with a lot of people, and giving them hope that no, to say that you have to learn with it, it's not the right thing. Of course, some we know that this tinnitus can mostly be caused by noise exposure and hearing loss, and there are so many other reasons. So I also learned that we have to ask them the right questions, because sometimes it could be as simple as they have got inflamed distribution tube, or they have got cyst, TMJ, or other times they may drink too much coffee or alcohol. Sometimes small things also, if we address that, they can also go a long way in addressing their tinnitus. Yes, hearing aids do help, but when it gets complicated and you can't really, we don't know what else to do, then that's when I refer them to audiologists who specialize in tinnitus and sound sensitivity, and then so that they have a what you say, good, more collaborative treatment approach. So this is where I have evolved over a period of time, and I've found that uh, reassuring the clients and telling that, listening to what they are saying and telling them the right information and asking them more and more questions definitely helps in for them to take the first step, which is very important. So as long as we can address what's, we can find out what's the root cause of it, and then we can work towards it, there is 50 to 60% guarantee that we will be able to help give them some relief from tinnitus. That's my 2 cents. Keith, would you agree with that?
Oh, definitely. I think both of you have mentioned that everyone's unique in different experiences or
Yeah.
hearing loss. I certainly, you know, um, when you said that, certainly everyone's different. And a friend of mine, when I spoke with, he's got a different set of circumstances as well. So we're all unique in how we've experienced either hearing loss or a tinnitus. And I like the idea you mentioned about the different experience that may affect that, like alcohol or coffee or something else that we take for granted. It, like, oh, why would that happen? We don't know. It's probably deeper than that. And now that you highlight that, I'm thinking, is
I'm
my
going to
coffee
answer
intake
that.
too much?
I'm
No,
Go
going to
on,
answer
please.
that
I would
very
say
soon.
that,
Yeah,
look, the thing
yeah,
is,
yeah,
there is a link between everything. So if you are
yeah,
really stressed about your tinnitus, or if you are so much is going on, or sometimes people have a lot of trauma. So to compensate for that, they either drink a lot of coffee to go through the day, or they drink a lot of alcohol to forget it. So everything is linked. So that's why
yeah,
asking them and asking them a lot of questions and deep probe of it definitely gives you a perspective where you can, as I was saying, address the root cause. Once you do that,
mm,
you
mm,
already are halfway there.
That's an
indeed.
excellent discussion. Let's listen here from Rachel. What does she think? What do you think about coffee, salt, cutting down
Hmm.
pickles, and giving up chips, giving up milk? What's your opinion, Rachel?
Well, I mean, I always say, yeah, because I'll always give my clients some strategies to work with. And one of them is to sort of reduce your salt intake, reduce your caffeine. But then in saying that, as a person who loves their caffeine, I will say, but if it's taking, if it's making you sad that you can't drink coffee anymore, well, look, don't worry about just drink coffee, because we don't want to
We
we
want you
don't want to
happy.
Yeah, that's right. We want you happy, and so. But yes, I do sort of say, and I also say having a healthy diet is really important as well, because I think sometimes too, if we do eat a lot of processed foods and drink a lot of soft drink and things like that, that definitely can because we want to keep a healthy body, healthy mind.
Healthy mind, yes.
Yeah.
Stewart, do you have anything to say about coffee or food intake or general health and well-being and how it connects to tinnitus? Any experience there?
Not really, not in terms of food and coffee. I sort of slightly related, but if I eat an apple, it makes my jaw click, and my tinnitus actually elevates.
Your tinnitus actually, can you please repeat
Elevate.
that?
Yeah, so
Elevate.
It,
Okay.
it
yeah,
elevates, yeah.
Stuart has jaw issues, and I think that
Okay.
definitely exacerbates
That
his
definitely
tinnitus.
adds to it. Yeah.
Yeah. But in terms of
Yeah.
food and such like, I can't really say that it's made any effect. But then I haven't
At this
actually been
point of the
listening to
discussion,
the
I would like to point out to something very interesting that I came across last year when I started studying my Masters of Digital Health. So, most of the time we are clinicians, we are looking at clinical stuff, we are trying to join the dots, especially in tinnitus. When you work in this field, it is very important to know how to join the dots, how to know how brain affects the ears, how your toenail affects your ear. We also need to understand that how your hair affects your ear. You need to understand how every small little thing in your body can affect your ear or your brain. Now, but how do we understand that? That's the problem. And I always faced it. In the clinical practice, we did see patterns where we were aware that things like coffee, salt, GERD, gastrointestinal reflex, sometimes chronic pain, sometimes just general congestion of the nose, sometimes allergies, sometimes neck stiffness. They were causing or they were triggering tinnitus for people. But I couldn't make sense out of it as to what is the real reason, and how do we know what is adding the most? What is the cause and what is the trigger? As Dr. Gupta was mentioning, cause and trigger. Once we can determine what is the cause, what is the trigger, and how much each one is contributing, it's easy. It's easy to handle tinnitus, very easy. So during my studies last year, we were doing public health studies, and in that, I got introduced to this new way of thinking, and it's called systems thinking approach. Right? I read just a paragraph of it, and I felt so happy and empowered, and I was like, "This is what I needed to hear. This is what is happening in tinnitus." Tinnitus is not about one system. The systems thinking approach, according to systems thinking approach, it says that when you look at individual systems alone, like for example, if you look at ear, eye, hand, leg, nose separately, they may not have a relationship with the tinnitus. But how they affect the tinnitus will depend upon how each one of them are feeding each other, and what the overall influence of that little bit of feedback, the feedback loop that it creates. What's the overall outcome of the system? That's what decides what the person would experience. And tinnitus fits so well in it. And I remember writing a LinkedIn post immediately after it, that, oh my God, it's as if, I've learned this something new. I've got this new magic wand. And since then, we have changed our approach a little bit, at least of understanding. Even if a patient come and says that my foot starts hurting every time I'm walking with flat slippers, and next day my tinnitus gets worse. And you would sit and think, how would wearing a flat slipper or thong would affect their tinnitus? It's difficult, but if you understand the systems thinking approach, and this is for every audiologist sitting out there and listening, if you're not familiar with systems thinking approach, especially in healthcare, please go and read about it, please. If you understand that if someone has plantar fasciitis, what's that? What's that word? Plantar fasciitis. You guys know what I mean. If they have that, and if they wear flat thongs, or they don't have proper wheels or proper support there, the tendon there gets irritated, inflamed, and it starts hurting. When it starts hurting, the person can start limping. And if they're limping for a few days, if they have been limping and it's a chronic issue, they may start tilting their neck to a particular side, they may start tilting their jaw to a particular side, and they may feel more fatigued as compared to otherwise. And that overall fatigue, that overall stiffness in the musculoskeletal structure is enough. It's enough to make the tinnitus worse. But what our brain does, our brain is very clever. It tries to blame everything on the tinnitus. The brain can't understand what's the relationship between the two. It just can't. It thinks my tinnitus is worse today. That's where a therapist's role comes into picture. An audiologist who's like a therapist, who can help you to understand what's the link between these small little triggers. So is it actually the tendon causing the tinnitus? No, it's not. But it's a secondary, it's feeding into it. And that's where a systems approach come into picture. If you understand the musculoskeletal connections from foot to the brain and to the ear, you will find there's something. And someone who's already hyper vigilant to tinnitus and hyper vigilant to things going on in their body, a little bit is enough to take them off the hook. So that's a very as Dr. Gupta said, small things, and as Keith said, um, he had to come back, and he was not hearing clearly in the noisy places. I remember that appointment very well. Keith came back and said, "Yeah, the tinnitus is better, but it's not very. It's still there, and it's." So I asked him. I said, "Do you think you've had a relief?" And I vaguely remember he smiled because he didn't want to say he didn't want to say yes. He didn't want to say yes because he didn't, but he didn't want to upset me. I think he's very kind. So he said, and I said, I got my answer. And this is a personality, like people like Keith. They don't want to complain because they like to learn to live with things. This is what Keith said. He likes to learn to live, and he. If you had seen him, you would not have believed what results we got when we tested the UCLs for him later. Right? So based on what he told us, we tested his UCLs, which we were not doing routinely at that time, 3 years ago. And we realized first time that Keith had moderate hyperacusis, which was the missing link. We didn't know. And that was the reason the tinnitus was still inducing annoyance. But it didn't get worse because who Keith is, right? He just had trust and hope in the treatment that it will work. So at least it didn't get worse. That's where the individual characteristics and the identity of the person comes in. So I remember apologizing and saying, "I'm sorry, Keith, we missed it." But I said, you should learn to complain. At least when you go to your audiologists and to your doctors, don't be nice. Tell them what exactly you're experiencing. And that's when we decided to start the sound therapy for you, right? Is that right, Keith?
Correct.
Am I missing
That's
any
correct.
detail there? Yeah.
No,
And
I
then we
think
started. Yeah. Sorry. Go ahead.
I was going to say, that I'm not a person that like to complain. I can try and deal with it, but certainly those side issues I had, that when you saw my report, saw there was a link there somewhere that may have, been the start of that as well. And I've had a long history of that hypertension. Yeah.
Yes. And it correlated very well with your history of work, the occupational hazardous levels of noise that you were exposed to. And while we are
Mm.
discussing that, I may want to say this good news here. So veterans, we know they have got subtle damage of auditory system, and so many times PTSD, which is not even identified, and that becomes a big cause of their tinnitus. The Veterans Department of Veteran Affairs is very kind, and they are very helpful to audiologists in helping everyone who comes to us. But recently, I think they have realized that just hearing aids and fitting hearing aids are not enough. They have changed some policies, and they are now looking at providing more support for veterans who have had tinnitus and who have used hearing aids for a while, and still their tinnitus is not improving. And that's where techniques like tinnitus retraining therapy, cognitive behavioral therapy comes into picture. Because in veterans, we know that tinnitus is long term, it's not a short term thing. It starts creating changes at the brain level. And when the tinnitus becomes central, meaning when it starts changing the structures of the brain, the neuroplasticity, that's when it becomes very stubborn. So in
Mm.
that case, we have to add more strategies. And that's a good news,
Hmm.
Keith. We can get you back for that.
Right.
So there is it's an approach where we don't start everything from day one, right? We always have to start one thing at a time. We see what is working, what is not working. The approach has to be fine tuned, and that some people can get a bit disappointed because they want quick fixes, which is fine. If I was in their situation, we were in their situation, probably we would look for quick fixes too. What is your opinion, Rachel, about veterans who come with hearing loss?
Yeah, and I think too, because they've had such a lot of noise exposure as well. Um, but yeah, I think it's really important that we, from the counselling point of aspect, that we give to our patients, as well as that we really need to make sure they have got realistic expectations about it as well. And that's what I've actually found, is that my patients who do have realistic expectations will definitely get more benefit than someone who just thinks, oh, I can get a quick, pop this in and it's all going to go away. So yeah, I think definitely having, and also attitude of the patients as well, I think is a big thing too. If they have a positive attitude and they really want to help themselves, that makes a big difference too. And
Makes a difference.
I don't know if I should say this, but I'm going to. But
Please
I do.
do.
I have had some patients where I feel like they don't want to help themselves. So, and I
Yeah,
found those people were the ones that didn't really get a lot of benefit. But the ones that do really have a positive attitude and really do want to help themselves, they're the ones that will definitely get the most benefit out of any kind, whether it's strategies, hearing devices, sound maskers, whatever.
you said a very interesting thing there, and I'm sure me and other clinicians listening and Dr. Gupta here, we would all agree to you. There are situations where we know the patient needs help, and we can help, but they are not ready to take up help. Why do you think that happens?
Uh,
I'm sure there's many different reasons why it could happen.
What's your opinion?
Sometimes, yeah, well, I think sometimes, I don't know if people, if they want to help themselves. Sometimes I think if there's other issues going on, then they, like you said, they can blame their tinnitus, and it sort of gives them an excuse for things. That's probably what I've sort of found in the most, is that sometimes people, I don't know if they like being miserable or.
Do you think there
and
can be other barriers like funding for the treatment or
Oh, look,
emotional support or family support?
yeah, definitely that. And I think definitely the funding is a big thing too. Like there is some, that can definitely be a barrier for some people. But I will try to give people lots of different options. So I say, I can give you some. I like to say, like, have this tinnitus toolkit where we'll give you all these strategies, and then you can draw on those strategies as you need to. You don't necessarily have to have hearing devices, a sound masker. I can teach you some strategies that you can use yourself to try to help with the
Try to
tinnitus, and
help.
definitely emotional support too. I find that sometimes if they're living by themselves, they don't have family or friends close to them that they can talk to, that can definitely impact them as well.
Impact, yeah.
look,
Dr.
all
Gupta,
these
what,
things.
yeah,
Yeah.
sorry, I was
No,
going to ask you to add your opinion over there. Yeah,
I
go
agree
on.
to both of you what you're saying, but I feel there's one more aspect to it, is that a lot of clients, because they've been bombarded with a lot of negative information, especially
Mhm.
on Dr. Google.
Mm,
So by
yeah,
the time they come, they have this thing firmly ingrained in them that nothing can be done, and these people are just
yeah,
making a fool to get something out of me. And so that's where reassuring them, giving them the right information, they will slowly come out of that shell that yes, what this person is saying makes sense, or they understand my problem, so maybe I can be helped. So some people's attitude do change over a period of time. May not be in the first appointment, may not be in the second, but gradually when they see that this is all starting to make sense, and they also know people come from different issues. They may have pretty bad trauma in their childhood which they are not ready to open up to you in the first appointment, or they have got something else which they don't want to tell you in the first appointment, and they've got so much negativity and negative information that they are very scared or they have given up. So that's another aspect where we find that why this person doesn't want to have help when he can be, or why he's going to that extent. But these things with time or gradually can change and have changed. So it depends. So rather than just judging a person, that's what I'm learning, that don't discard what they're saying, listen to them carefully, and then slowly join the dots. And at the max you can only tell them, and if it starts to make sense to them, they may not do anything in the first appointment. They may come after 3 months or 6 months. Oh, that is make what you said made sense. I thought about it, and they may seek up. Same person who didn't care about it, or he didn't want anything, would have a different aspect. This is my opinion.
Well, I would like to say both of you have added really a good depth there, because both the things that people don't want to help, we see that. And we also see why they don't want to help. And I actually had a very long discussion about this topic with a psychologist of mine. I did one full session with her at some point, because we are audiologists and we can't think like therapists. We don't understand why people are taking decisions in certain ways. And as we all know, people want to help themselves, but why are they not? And what is stopping them from helping? And yes, one of the issues with tinnitus is there's so much negative counseling on the internet, because of the lack of awareness that nothing can be done, that people are convinced that nothing can be done. Now, at this point, everybody is convinced nothing can be done, but who is the person who will come and take up the treatment, and who will go ahead with the recommendation? That is where the identity of the person lies, and that identity depends upon, this is my psychologist, right? This is what I learned from her. That depends upon the traumas, their mental health history, and their experiences. If the biggest indecisiveness is a sign of underlying cognitive distortions, right? Unhelpful thinking leads us to indecisiveness, that I know what to do, but I can't take the decision because I'm very scared. So inside, probably everybody knows, they know they need, but how do I trust this person? How? And we are not therapists. We don't know how to do that. That is our, I get very emotional about this in the clinic, that I would like to help the person sitting in front of me, but I do not have that toolkit. I do not have those strategies to dive deep into their brain and see how the trauma or the past experiences are creating a barrier today. How I wish we as audiologists were trained more in this bit, so that we could help those who are not able to take a decision to go to a decisive side. Right? Is that what you both meaning, Rachel and Amit? You don't have to
Yeah.
agree.
Oh no,
It
I
doesn't.
agree, and I think you're right. Like, I think too, there's a lot of trust. People have got to have a lot of trust in you, because they're coming to you, and a lot of the times they're in a quite distressed state. Um, so yeah, and they, like I said, if they've had bad experiences in the past, a lot of them are very anxious about their tinnitus and thinking, "Oh my goodness, is there something wrong with me? What's going on?" So yeah, they've got to really be able to trust you. Um,
Yeah.
it's
But
a
with
big thing.
patience and with more studies in psychology, self studies, we can get onto that. This is where learning cognitive behavioral therapy with Harsher from Harsher International really helped me, because I always felt I did not had a therapist language dealing with tinnitus, hyperacusis, and not understanding. Of course, we understand the auditory system, we understand tinnitus, but we don't understand how it can change the autonomic nervous system and stuff. So this is where, so a big need in audiology world for all the clinicians and researchers listening to us is to add in curriculum some kind of audio psychological training, identification of signs and symptoms of underlying mental health conditions, and very important to be able to distinguish whether their symptoms are reactive symptoms or are they chronic symptoms? Meaning, is it the tinnitus and sound sensitivity that is causing their mental health symptoms, or is it the mental health symptoms that is causing the tinnitus? That's very important for us audiologists to be able to determine because the treatment approach is completely different. Someone having a reactive depression, reactive anxiety, the treatment is different. You treat their pain, you treat their tinnitus, help them out. Automatically, that hyperactivity in the limbic system, autonomic nervous system goes down. But if they have had chronic anxiety, depression, and because of so many other life reasons, and now they've got hearing loss, and together it's causing tinnitus, just by hearing aid, yes, the tinnitus may not go away. In that case, we guide them to go and take more help in terms of therapy, trauma therapy, cognitive behavioral therapy, getting a better routine, getting better sleep. Just going out for a walk for 10 minutes has helped people because they can't motivate themselves for 10 minutes walk. And once they can start going for 10 minutes walk and they will do it because they trust you, that changes their lives. And that changes their tinnitus because they go out, they feel happy. So knowing whether stress is causing the tinnitus or tinnitus is causing the stress is very, very important. I've had patients, I would like to share this very openly. I've had many people coming for with GP referrals and referrals from many healthcare providers where they come in and cry and they say, my doctor is saying my tinnitus is because of my stress. But my stress has been there and I'm not so stressed, but why the tinnitus? And it's it's difficult to tell them that that may not be true, but then the doctor is only trying to help. They are telling what they know, right? So this is what we tell them that look, your doctor understands your mental health history, everything. This is what they know. They've told you. They've done a big help by sending you to us. I can understand that your tinnitus may not be because of the stress. And the moment they hear that, they feel so validated. Half their stress goes away because in their brain, their stress is not causing the tinnitus. They know 2 months ago, I was happy, cheerful, going out, going to the parties, and now I can't even move out of the bed. How do you convince them it's the stress that's causing the tinnitus? No, you shouldn't need to. And if they are, so just conversations like these in initial assessment can make a huge difference for all the clinicians who are listening. Very important to know which is causing what,
I
whether it is real. Yeah.
I'm sorry. I was going to say, no, I 100% agree because I think sometimes just talking to people, that can help a lot as well. And just making, and for them to realize that someone is listening to them and like, like you said about being validated, their feelings
Being
validated.
validated. Yes,
Look,
yes.
lot
And
of
then at the
patients,
same time, yes, Amit.
I would ask Keith and Stuart this that validating their concern is a very important and a big step because until unless you suffer from tinnitus, you really don't know what they are going through. So once you validate that we understand what you are saying or feeling and what you're going through, itself is a big step for them that they know, okay, they understand what I'm going through, so I'm not going nuts, or people may make fun of me, so
Yes,
it's not that. So they know what it is. So that's a very, I completely agree. That's a very important part of this whole journey for our patients. So Keith and Stuart, do you? What is
absolutely.
your opinion on this?
Stuart?
Stuart, would you like to go? Would you like to add something on validating
Um,
patient experience?
yeah, look, I haven't been able to hear uh, Dr. Gupta or
Okay, do you want me to
Keith.
repeat it for you? Can you hear me?
Yeah, yes, I can hear you. Yeah.
So Dr. Gupta was talking about validating our patients' experiences, real experiences during the appointments, and he wanted to hear from you and Keith what What is your opinion as a patient? Is it important for you to feel heard during your appointments and to get validation for what you are experiencing?
Oh yeah, absolutely. I I guess that the mental health aspect of bad tinnitus um, can actually be quite traumatic, and that would alter your the way you think about things. I'm a bit of a holistic type thinker, and I think that everything filters in. Uh,
Yes.
and if that comes out in what you say and what you think, well, that's kind of natural. I suppose that you've always got your rational aspect of you where you can actually control it, but in I've come to believe that emotions are actually sort of like a linchpin in this. They control everything in actual fact, I think. It depends on your personality, I guess. But I think that it was really good to hear both Kim, my GP, and Rachel to actually listen and understand it. Like it was great to actually, especially Rachel, to actually understand what I was actually going through, and then gave me examples of what was actually happening, you know. And it was really good, and it's also really good for me to actually understand it from a physical point of view, even though the cause of it is sort of out there, who knows. But it was really good to actually get that more rational approach to it, I guess, and to take it away from my emotional aspects, which were telling me it's all bad, you know. Well, of course, it is not good, but um, it's not the end of the world, sort of thing. But yeah, that would be, yeah, I would agree with that.
Yeah.
Absolutely.
Thank you for that reflection. Keith, would you like to add something there?
Yes, certainly. I think the validation is so important for the patient or client coming in. For me, when I received that validation, straight away in my mind, I said, he's genuinely concerned and wants to treat me. I've had experience where I go and see, a health professional, and I'm in and out before you know it, and I'm thinking, oh, I should have gone to the chemist and pick up some Panadol. So for me, when I first went to the clinic, I was like, wow, these guys are really professional, and they're validating my condition and really want to help me. And that just gives me a bit more, I guess, belief in the system, in your approach to me, and you're genuinely concerned. So for me, that was a big plus. Straight away, I've said, look, I'm coming back again because there's something here
Mhm.
that's going to help me. Indeed.
And we are so glad you came back. We made friends and we had a Christmas party later that year, all of us.
Now that really spoilt me, Minnie, because I was looking for the next party. No, it's wonderful. I
Yes,
think that a whole approach with like more like a family clinic, that friendliness,
yes.
that really encourages,
Yeah, we didn't have
everybody.
a
And,
party, by the
and
way, last year. We didn't forget you.
I know a lot of things were happening for everyone, I'm sure. But yes, look, apart from that, I think feeling that when you go in there and you get, and how are you today, Mr. Dela Cruz, or how are you, Keith? That is really good from, someone that doesn't know me or may see me once in a while. That validation from the very start is so important. Yes.
It's both ways. You have been a very pleasant patient. We have really enjoyed dealing with you and your wife. Yes.
Thanks very
Okay.
much.
I think we have Marius here. I'm not sure if she's still. Marius, can you hear us? Are you there?
Yes, I am
Oh,
here.
oh, you are there. Okay.
Sorry, I'm not
Sorry.
dressed up. I didn't expect to be. That's okay.
Sorry, because we couldn't see your picture, so I wasn't sure. All right, so let me introduce Marius to you here. Marius is he saw us few months ago, I think July last year,
I
for
think
his
it's
tinnitus.
well with you, but first time it was
I'll let
the
you
end
I'll
of
let you introduce. Why am I doing that on your behalf? Please, Marius, go ahead.
No, I can obviously talk. Would you like me to just unfold a little bit
Please,
of my
please,
experience and my
please,
progression?
please, please. We are all
Okay.
waiting for it.
Well, how do I say it in a concise way without rambling? I guess I was diagnosed with tinnitus maybe 16 years ago, and I had a little bit of struggle. I went to a few ENTs and things like this, and I think I end up with one of the clinics similar to yours, Mini. And at that time, I really did not get much help, but someone did a very good job by telling me something that it's. I need to keep on reminding myself. That person explained, listen, you're wearing the clothing as we all do right now, as I can see on the screen now. But we don't even feel it. We don't think about it. We just accept it. Our brain really managed to understand that wearing the clothes, well, it feels kind of strange at first if you have never worn it, but after some time, it causes no emotions, negative, positive. So the brain, it has the ability to put it aside and we never think about it. And this person back then told me that, I'll be fine. And I guess it gave me a little bit of hope. And somehow I managed to shake it off, to be honest, to accept it. And maybe my brain shifted the attention to other things, and I was fine. But unfortunately, I had a little bit of stress in my life, to say the least, over the last few years. And in February, March this year, I really realized that something is wrong with my head. And I was in a very bad place. I got really surprised by that, and I did nothing. I waited for things to get better, and they never did. And my conditions was getting worse and worse and worse. And I needed to reach out to someone influential in my life. And that person told me, Marius, you've got to go and you've got to research it, you've got to check it out, you've got to see what options you have. And really, that kind of triggered me to really look into it. And I started researching desperately, because at the time I really was in a very bad space. I really felt like don't want to keep on going almost. I was really like emotionally stuck, thinking, I've always been able to fight everything off. I've always been able to go to gym and run it out and do my weights, whatever. Not that I'm a big weight lifter or anything like that. But on this occasion, I felt completely out of control. It was in my head and I could do nothing. Cutting long story short, I came across this strategy, the I don't recall what's the name, the brain retraining
Tinnitus
therapy.
retraining therapy. Tinnitus
And
retraining therapy.
I looked into it and I found a few companies in America, but I said, well, a little bit too far for me. I was desperate. I would have gone, but then I started doing the research and I found Mimi Gupta's image with with the person who actually was like the person who worked on that strategy. And I thought, wow, I have to go there. So I was desperate. I was on the phone. I recall that morning I went for a coffee and I called the clinic. I think, I hope I will get through. I hope they will see me soon. And they did. But I was in a very bad space emotionally. And Ingrid was very kind and to see me immediately, and really gave me a lot of hope and vision. And I think the most important thing for me was, because I was really broken down. I'm thinking, this is it. I mean, what's going on? I had a few challenges in my life, but this, I can't do much about it. And for me, what really made a difference for me, I know we talk about a lot of strategies and things like this, but for me, first of all, it was that someone honestly could look in my eyes and with honesty say, there is a hope for you. And and when you at that point that you really have no hope almost, if you find someone like this, I think there was a turning point for me. And I remember I said, just tell me the truth. I don't need you to be nice to me. Just tell me the truth. What's how many, is the hope? And she did not she was very sincere, and she continued with me, and I really started to get the hope of improvement. That was actually a big turning point. And then I had opportunity to meet with you, Mimi, and you reinforce all this stuff. And you recall me, I am not emotional person. I am the person who can deal with anything and everything, but that was not the session we had. I know. And you were very kind, and maybe that's what I needed. I was really hopeless. And I think that the hope of some of the videos I've seen on the YouTube, and the hope that you guys are there and you use the same strategy that helped a lot of people, give me everything I needed. And and then I really started to move forward. I committed to I realized that tinnitus is a complex thing. And your sleep, your anxiousness, your worries, everything can influence this. And I knew that at that time I had a very limited opportunity or ability to do anything about my tinnitus. So I decided I'm going to sort it out all other problems that I can control. So, I started going more to gym. I started doing running. I started really looking at my sleeping patterns and changing my life. Like, for example, I used to go to gym. I used to do running at night. And I thought I was doing the right thing, but it was a big mistake. Uh, it actually deteriorated my sleeping patterns, because the what do we call it, the cortisol stayed in my, so I felt relaxed for 2 hours, but then cortisol stayed within me for the rest of the night, and I usually end up with very bad sleeping. But so I think that someone genuinely look in your eyes and tell you that there is a hope for you, that I think it's a turning point. It was definitely for me. And I've already done my research on the all the hearing aids that deliver the sound to your ears, as well as the pillow that you use at night. So for me, it was automatic. I did not really care how much it cost, because I was so desperate. Um, and Ingrid was very kind. He said, "Think it over." I said, "I am not thinking it over. I am committing right now. I want to. When is that? When can I pick it up?" And she said, "Well, let me check it. Well, you pick it up tomorrow." And I needed to do it because I was departing in the next 3 days or so to Poland to see my father. So I needed to see the action very quickly. But yeah, I think this hope of, I think this is, I think that's probably for different people are different reasons. But for me, it was the emotional support and hope from someone who I felt was genuine, that really made a difference, and then fuel my ability. And now I'm absolutely fine. I don't wear anything. I don't do anything. I basically don't even hear it. And if I hear it, I trained myself not to be anxious about it, because I always remember the bad days and the improvement. So I know that the good time will come. So I try to be busy. I try to develop habits in my life that support my well-being in a way. I spend most of the time in front of the computer, and I'm busy. I'm engaged. I'm doing my stuff. So I do not hear anything. Then I might hear a little bit, but then I come home and I work around the house, because I like physical work. I like to do the garden and things like this. And I think having that strategy, I guess, of helping yourself, I guess, and knowing what works for you. And I think it's very important, as Mimi said earlier on, you need to pay attention to what's happening with your life. You need to analyze your life. You need to see, well, I had a bad day. What happened? Was there anything? Is there any pattern? So sometimes you can work it out, sometimes you don't. But I think it's the ability to reduce the overall anxiousness about your life. It's the key point, because the more stress, the fewer stresses you have, you will sleep better, you will you will feel happier. um, and I think you need to, one of the things I also made a priority for me is sleeping, although I'm not perfect. So I love talking to my sons. They're adults, like 22, 24. But when 10, 15 comes, I said, "Matthew, I have to go, because at 10:30 I hopefully should be trying to fall asleep. And I think you need to create this pattern and discipline, because if you don't have discipline, if you're all over the place, well, you'll get what you earned, I guess. So I think I'm and another thing is I always had a trouble with sleeping. So one of the things I shifted my training from the night to the morning. I like coffee and I eat a lot of salt. It makes no difference to me. And I've heard those things, but I've created some boundaries. So my boundaries are that I can have as much coffee as I want, but only up to 10 or 10:30 in the morning. After that, no coffees. I allow enough time for the caffeine to exit my system. Whether that affects me or not, I don't know, but I'm just trying to do this. So I think you have to have a holistic approach, and you've got to try things, and you've got to be disciplined. You've got to create the boundaries. And I used to be in a very tough spot. I used to reach out to people from America and everywhere else. But now I feel I don't hear it. I don't hear it. It doesn't bother me. I probably will spend 5 minutes a day thinking about it. If I have a bad day, maybe 10 minutes. So it means I don't really have those bad days anymore. And I just keep on going with this discipline. But I always remember about the discipline and not letting my guards down, but just continue with the right habits to continue that healing, I guess. And for me, final thing is that I understood, because I actually read the book. I did not finish the book. I read the book written by the guy who actually came up with the strategy. And I understood that the brain has the great ability to dismiss things that are not important to it. And what does it mean that they're not important to it? It means they do not invoke any emotional responses, whether negative or positive. So there was a very important distinction for me. How do I not react to it? How do I distract myself? How do I do it so I don't feed that beast, basically, and allow that for the brain to push it further and further to the background? And I think that was my reading strategy. Every time I read it and think about it, I'm because I'm in a kind of strategy and business consulting, and so I need strategy. Without strategies, I'm all over the place. So I'm sure I probably rambled too much, but this is my story, and I'm doing very well right now. And I'm so thankful to you, Mimi. I went to Poland. I got you and as a
The
token of
doll.
appreciation, a beautiful, hopefully, a doll for you and Ingrid, because I never you really do it to that extent to strangers, if you will, at that time. But I was so thankful for that help. It was so important for me. It is something that no one else has done. So I will be always thankful and grateful that I had you and Ingrid to look after me when I actually needed that. So thank you so much.
That's an exemplary success, especially because your tinnitus, just to give a little brief to everyone, Marius has normal hearing, no hearing loss. This is what I remember. Am I correct, Marius? Maybe
Yeah,
just mild
apparently
hearing loss or something? Very mild.
I have the common thing, a little bit of the high frequencies, and I know
Yeah,
that's the
just
case.
very little bit. Yeah,
But
yeah.
a little bit of the high frequencies, but doesn't affect my life really. Yeah.
Yeah, it was very, very so no self-reported hearing loss as such. The tinnitus, of course, and I remember I was on leave that week when you had come because I was sick, and Ingrid messaged me with an urgent. Ingrid is our other audiologist, and she messaged me. She's like, "Mini, we need to do this for Marius. He's very stressed. We cannot let him wait. And can we do all these things?" And when I read the questionnaire that we get our patients to fill in before they come in, even I saw, but I somehow felt that this is not going to be very difficult. I somehow felt it's going to be easy when I read what Marius had written there. And then during the consultation, I could sense that things will change very quickly for him, despite the fact that the tinnitus was so bad and he has had it for a while. Because, and this is the reason why Marius has improved, not because we have done anything different. We do the same thing for everyone. We are here to help everyone. Whoever comes to us, we'll give the same service, we give the same hope. But Marius said, I will do anything that you want me to do, just make it better. Do not ask me if I want to do it or not. Just tell me what I need to do. And that is a game changer. That is where we were talking about the indecisiveness, right? The decision was already made by him. Our job was already done, right? We didn't have to do the job of explaining and building that trust because he already had the trust that tinnitus retraining. So the technique that we used was tinnitus retraining therapy, where we use devices to program sound for their tinnitus and maybe sound sensitivity if it is there. We do 24-hour sound therapy during the day, during the night, and it is not just the sound therapy. There is a very in-depth counseling and learning about the brain that Marius was talking about, how the brain filters. All that together goes on for a few months, almost 6 months. And that's when it comes to a stage where it's like, oh, it's not there anymore. Like people say, okay, does tinnitus ever go away? Yes, it goes. You've just heard it from Marius firsthand. It does go away.
Yeah,
It does.
that
And
is so I can still hear it actually, but I do
yeah,
not allow to be emotional about it. I do not allow to be focusing on it. I'm shifting my focus to other things, and then I realize that although I haven't, it's still there. I have not heard it for 3 hours because I just was not paying attention, and brain thinks it's nothing. It's nothing. It's the danger is gone. It's not the dangerous situation. So that
what
was
danger
very
word is, it's perfect here. This is what the retraining therapy does. It breaks that connection that the brain forms between tinnitus and fear. It breaks that connection. And tinnitus
but one
becomes
thing,
independent of fear.
Minnie, I want to say maybe for others there as well, because I don't know what they views or not, but having those aids in the first place gave me a little bit, and the pillow at night gave me a little bit of taking that edge off and gave me perception, really, perception of control that I'm doing something. I'm doing
Yes.
something because without it, I needed to do something. You know, like men are not talkers; they just want to get things done, and I'm unfortunately one of those. So that kind of gave me a little bit control that I'm doing something. I'll be better. So putting all this hope that I've received from you and from Ingrid, and adding, the technology, it gave me enough to keep me going.
Congratulations to all of
Thank,
us.
thank you.
That is a great outcome from that space to this space. You've done very well, Marius. We are all very proud of you.
Thank you so much. Thank you.
This has been an excellent session, I would say. Hear so many people say things and to show the vulnerability so freely. It's not easy. It's not easy to talk about our weak moments in life. It takes a lot. Yeah, and to stand there strong-willed uh, and deciding on something that you don't even know whether it's going to give you and paying all that money for it. These treatments are not cheap, they're expensive. Putting that trust, and that's where we need people with tinnitus to put their trust in that if you are seeing someone you really believe can do the job, put the trust in them and let them do the job. And then forget about what internet says. But you have to find that one. That is important. So tinnitus retraining therapy, that is the technique that we normally use, especially for people who have normal hearing and tinnitus or hearing loss associated with sound sensitivity. Tomorrow, 7 o'clock in the evening, again, I'll be back talking alone because I like to talk, as you all can see. I'll be talking all alone for 1 hour about tinnitus and retraining therapy. And I would highly, highly, highly recommend everyone out there to listen to it, not just the people who are experiencing it. Every clinician who's sitting and wondering, what do I do? Every clinician who thinks, I wish I could treat the tinnitus. And every researcher out there thinking, why are these clinicians saying that they can treat the tinnitus? How can they even claim that? Everybody, please come and listen to what I have to say. It's not my technique, it's not what I have developed. This is what the masters in the field have transferred to us as students, myself, Rachel, and so many of us. We are just following what we have been taught by the gurus in the field. and we are implementing it without doubting it and without questioning it. And I have a habit of questioning everything, actually. I don't know how I never questioned, because this made sense from day one when we read this. And we are very indebted to Dr. Pavel Jestrabov, Dr. Margaret Jestrabov, Dr. Hashir, and all our teachers and all the people who have helped us to be here today, to be able to do what we do every single day. And the support our colleagues give us, Dr. Amit Gupta, Rachel, so many others. We as audiologists also uh, get very emotional because we want to help everyone who comes to us, not just us. Every audiologist wants to treat people with tinnitus, but we are not taught how to do it, and that's our challenge. But we're all working together as community. The change is coming. Everybody is trying to do their bit. We just need people to now change their perception that tinnitus can't be treated. No, tinnitus can be treated. It can be managed. We can get you relief. And before I end, I have to say this. This is my favorite definition of tinnitus, and it's my own. It's a bit spiritual, though. It's not purely scientific. In my own definition, not as a professional, but as a person, tinnitus for me is the hum of existence. We are hearing tinnitus, that means I exist and I'm alive. If I did not exist, I will not have tinnitus. That's the first thing I want everyone to remember. Because tinnitus comes if your ear is working and if your brain is working. If your ear and brain stop working, the tinnitus will never be there. It's just that they are working slightly more. Now, how to bring that to normal and to a balanced state? That's where we specialize in. And the rest of it, the magic, I'm going to talk about tomorrow. 7 o'clock, live again. And thank you to everyone who's here. It's been great. Keith, Marius, Stewart, Rachel, Dr. Gupta, taking out time in the evening after the busy day at the clinic is not easy. I really, really appreciate this. I hope the message reaches to as many people as possible. And I hope this creates a change. And that is what we all want here together.
Thank
Thank
you.
you, everybody.
Thank you, Minnie.
Thank
you.
Thank you, Minnie.
Thank you.
you.